Ms. Fumiha.
So according to the Singapore Nursing Board's 2019 report, about 7,600 or 18% of our nursing workforce are Filipino. The Ministry of Health is closely monitoring the impact of the Philippines' suspension of permits. We are working with healthcare employers to ensure the adequacy and sustainability of our nursing workforce. Healthcare employers should also diversify their recruitment sources. Meanwhile, our local supply of nurses has grown. In 2020, there were around 1,400 new registrations from locals, compared to around 1,200 in 2019. This is a result of our past efforts to grow the nursing intake in our institutions of higher learning. We will continue to enhance the attractiveness of the nursing profession, and I hope more Singaporeans will join this noble profession, especially those who are considering a mid-career switch. Thank you, sir.
Ms. Fumiha.
Thank you, Deputy Speaker. I have two clarifications for the Senior Minister of State. First is, when COVID is regarded as endemic and restrictions are eased, infections are expected to increase and more vaccinated patients, that's the new protocol that was mentioned, that will be at the care facilities. So I'd like to ask, will this new health protocol put more demand on nurses? So that's the first question, as we evolve our health protocol with COVID being endemic. The second question is, how can Singapore ramp up our own supply of nurses to reduce our reliance on foreign nurses? I think the number that the Senior Minister State mentioned in terms of yearly intake, it looks like it's a small number if you ask me. So how successful has our professional conversion program been in increasing the number of local nurses? And how can this program be further enhanced to accelerate the pace? So if we're producing 1,400 per year, having put in a lot of effort, how can we accelerate that? Thanks.
So I thank the member, Ms. Fu, for raising these two clarifications. On how we would want to deploy our medical manpower, should there be more cases during the endemic phase that requires community care monitoring, I think it's important to understand the differences between acute hospital care requiring more intensive nursing care and community care that does not require the intensiveness of care monitoring. So that we have a few options. One is, of course, we do have a ramp-up plan for nurses to deploy into some of these community care facilities. We experienced that during the earlier phase of the COVID crisis last year, when we have a lot more foreign workers who are being cared for in the CCF facilities. There we have a complement between nurses providing more medical supervision as well as doctors, but there's also a series of other care providers, volunteers who are trained to actually use technology, for example, automatic blood pressure reading machines and oximeters, to also help to monitor the health status of those in those community care facilities. So in that way, we actually stretch the role of the nurses through partnership with other care partners. For the second question on how we can actually ramp up our local supply of local nurses, Singapore's stock of registered nurses actually increased by about 19% from 3,006 in 2013 to more than from 36,000 in 2013 to more than 42,000 in 2019. And this translates into almost 7.5 registered nurses per 1,000 population, which is a good number compared to many other Asian economies like Hong Kong and Taiwan. But as you said correctly, as our population ages, there will be an increased demand for healthcare services, and the manpower will have to increase commensurately. You will remember, members may remember that earlier this year in the budget, we announced several measures to also increase attraction of our locals to join the nursing profession. One, of course, is in the salary review, which we announced in budget this year. The public sector healthcare nurses will have an increase of about 5 to 14% in their monthly base salaries from July this year. So it just kicked in this month. And this will be phasing over the next 2 years. For publicly funded community care organizations who also require nurses, MOH will also increase funding support for wages to ensure that salaries in the community care settings are also competitive to attract locals to join this sector. We also encourage more flexible work arrangements. So in the sense that all healthcare clusters now have flexible work arrangements to help their workers strike a balance between their work and personal demands. These include part-time employment, compressed work week, flexible work schedules and hours, and to facilitate the scheduling of work shifts, e-rostering will be scaled across the public health sectors clusters by the end of 2021. There are also efforts to enhance professional development, such as through the launch of the skills framework for healthcare and the National Nursing Academy, so that nurses can continue to upskill themselves and advance in their careers. So I think it's through a multi-pronged approach. First, making sure that the work environment is much more conducive, much more flexibility, but also creating different skill pathways for different entrants into different care roles to progressively go up into taking more advanced nursing roles. So in that way, we create a more attractive environment for different people or different capabilities to join the healthcare sector, and especially to attract the mid-career entrants. Thank you very much.